Menstruation, commonly known as periods, is a natural biological process experienced by women and girls as part of their reproductive cycle. Yet despite being one of the most fundamental indicators of female health, it remains a topic clouded with misconceptions, stigma, and silence in many societies. From a medical perspective, the menstrual cycle is controlled by complex hormonal changes involving estrogen and progesterone, preparing the uterus for potential pregnancy, and when pregnancy does not occur, the lining of the uterus sheds, leading to bleeding that typically lasts between 3 to 7 days, though it may vary for each woman. During this time, women can experience a range of symptoms including cramps, headaches, bloating, fatigue, mood swings, and sometimes more severe conditions such as premenstrual dysphoric disorder, PMDD, or endometriosis, which require medical attention. And doctors strongly emphasize that women must prioritize self-care during their periods by avoiding overly strenuous physical activities such as lifting heavy weights or engaging in extreme workouts that can increase cramping and exhaustion, focusing instead on light exercise such as walking or yoga, which may actually help reduce pain, while dietary habits also play a crucial role since consumption of junk food, excessively oily meals, carbonated drinks, or too much caffeine can worsen cramps and bloating, whereas a balanced diet rich in iron, leafy greens, fruits, and hydration helps maintain energy levels and reduces weakness. Medically, it is also critical that women maintain hygiene by changing sanitary pads every 4 to 6 hours to prevent bacterial growth and infections such as urinary tract infections or toxic shock syndrome, conditions that can have serious health consequences if neglected, and alongside physical health. Mental health must not be overlooked since hormonal fluctuations often lead to irritability, stress, or sadness, making relaxation, sufficient sleep, and emotional support from family and friends essential. Despite this medical knowledge being widely available today, many societies across the world still attach unnecessary shame and taboo to menstruation, treating it as something impure or unclean, and in some cultures, women are even isolated during their periods, prevented from cooking, entering places of worship, or attending school. Practices that not only harm their dignity, but also restrict their social participation and create a cycle of misinformation passed on from generation to generation. Lack of education about menstruation leads to dangerous myths, such as the idea that women should not bathe during periods, which can actually harm hygiene, or that menstrual blood is toxic, which is scientifically false. And these misconceptions contribute to an environment where young girls often enter puberty with fear and confusion rather than knowledge and confidence. Globally, millions of girls miss school during their periods due to lack of access to sanitary products, clean toilets, or simply because of embarrassment fueled by stigma, and this absence has a direct impact on their education, career opportunities, and empowerment, highlighting that menstruation is not just a personal issue but a societal one with wide-ranging consequences. Breaking this stigma requires open conversations in families, schools, and media to normalize menstruation as a natural process, campaigns to distribute sanitary products to underprivileged communities, and healthcare systems that provide accurate menstrual education and treatment for conditions like irregular cycles, polycystic ovary syndrome, POS, or anemia caused by heavy bleeding. At the heart of the issue lies the concept of women's empowerment. For empowering women means not only allowing them to pursue education and careers, but also creating an environment where their health needs are respected, their biological processes are understood without prejudice, and their voices are heard when they express pain or require support. And this includes recognizing the unique challenges faced by pregnant women who are living embodiments of strength, balancing the nurturing of a new life while often continuing household or professional responsibilities. And just as pregnant women need rest, medical care, and family support to avoid complications, menstruating women too need compassion and respect, because neglecting their needs can lead to long-term health consequences. Society must shift from viewing periods as a barrier to productivity or purity and instead view them as a natural sign of life, resilience, and continuity, encouraging men and boys to be part of the conversation so they can support their mothers, sisters, wives, and daughters rather than perpetuating silence and shame, because menstruation is not solely a women's issue but a human issue tied to health, dignity, and equality. the medical community continues to stress that awareness and openness about menstrual health can prevent complications, improve women's overall well-being, and reduce healthcare burdens, while socially, acknowledging menstruation openly helps dismantle gender inequalities that are sustained through silence and discrimination, and therefore the call to action is clear. Women must practice self-care during their periods by balancing rest, healthy food, hydration, and hygiene, while society must simultaneously remove stigma, provide access to menstrual products, educate both boys and girls equally, and create policies that support menstrual leave or flexible work for women experiencing severe pain. Because when both medical guidance and social acceptance come together, women are not forced to choose between their health and their participation in society. Instead, they are empowered to thrive, proving that true women empowerment is not only about breaking glass ceilings in workplaces or education, but also about respecting the most basic, natural processes of their bodies without judgment or discrimination. And in this respect, menstruation becomes a symbol of strength, resilience, and life itself, deserving of care, respect, and dignity from both medical systems and society at large.